I am such a big believer of getting your basic blood work checked once a year at least, because it's the only way to actually tell if you have something like this. And if you stick with me until the end of the video, then I'll also share the top foods to eat most days to bring your iron stores back up or just maintain them at a healthy level, and also exactly what to do if you suspect that you might be deficient in iron after going through these signs and symptoms. Now, if you're new to the channel, then hello, welcome. I'm Dr. Alex. I've worked in emergency medicine for pretty much 10 years now. And one of the things that's really stuck with me during those years is just how often we'd pick up iron deficiency in a patient on a routine blood test, you know, for somebody who's come in for something entirely different, like they've just been feeling a bit off for the last few weeks or months or even years sometimes. And if you find this video useful, if it helps you in any way, if you really find you get something from it, and you want to support what I'm doing here because it's just me on this channel, there's nobody else behind it, then the best thing that you can do is hit the subscribe button and also hit the thumbs up button as well. It really does help me to reach more people who could benefit from this sort of information. Now, iron is obviously a metal that sits at the very center of something called hemoglobin, which is the protein inside your red blood cells that carries oxygen from your lungs to literally every single tissue in your body. Without enough iron, you simply can't make enough functioning hemoglobin. And without enough hemoglobin, your cells cannot get the oxygen it needs. So every single cell in your body then starts running short of fuel, and it causes lots and lots of different symptoms, from very specific ones to quite vague ones as well. Iron also plays a role in your immune system and your hair as well, and your nails and your skin, and even in the production of certain brain chemicals that literally affect your focus and your mood and your cognition as well, which is why the effects of low iron spread literally across far more of your body than a lot of people actually realise. So in the A&E, in the emergency department, we measure hemoglobin on virtually every patient who walks through the door, because so much of what we see day to day can either cause it to drop or be caused by it being too low. Now, if we find it lower than expected, then we start looking at the rest of the bloods to work out why. The first clue is usually coming from the size of the red blood cells themselves, which is reported on a blood test called MCV, the mean cell volume. Now, in iron deficiency, the cells tend to be smaller than a normal red blood cell because there isn't enough iron available to actually fill those cells properly, so they're smaller. And that gives us our first really big hint. The next thing we look at is ferritin, which tells us how much iron the body has in storage. And then we look at a couple of other markers like transferrin or transferrin saturation, which together give a much fuller picture of your iron economy than hemoglobin alone ever could. And the reason this matters is that hemoglobin can still look sort of acceptable when your stores are already running dangerously low. So unless a doctor actually orders that ferritin blood test, the deficiency very often is just hiding in plain sight. The other thing worth flagging at this point is that iron deficiency in an adult is rarely a diagnosis on its own. It's always a clue pointing towards something else. Now, the most common reasons in adults are inadequate dietary intake or heavy menstrual periods in women, or, you know, a bit more serious, a slow hidden blood loss from somewhere in the gut. And that last one is the one that I want you to take really seriously from this video, because there are some clear red flags that you should never ever ignore. If you're passing blood in your stools, or you're noticing that your stools have turned quite dark and tarry or a bit sticky or black, and that could suggest that you're bleeding from higher up in the gut because blood that gets digested and works its way through then turns black, or you're vomiting blood, or you're losing weight that you can't explain and you're also anemic, then these are signs that your doctor absolutely needs to know about pretty soon. If you're bleeding from anywhere and you shouldn't be, then you need to go straight to the A&E, to be honest. But for the other symptoms in this video, just these persistent sort of low grade symptoms, then the right step is to book in with your doctor, with your GP, and ask for a proper examination. They should take a full history as well, and you should get a proper set of blood tests. And I completely get that it's hard to get a doctor's appointment these days. You just have to keep ringing them up every day or go to the surgery and say, I'm concerned that I could be anemic or I've got these red flags and I'm not leaving until you give me an appointment, because some things, need to be investigated quite urgently. So the first sign, and by far the most common one, is a kind of tiredness that doesn't respond to a good night's sleep or a couple of days off work. So we all feel tired sometimes, but iron deficiency tiredness has a very different quality to it. If you speak with a patient that has a low iron or a low hemoglobin, then they will describe it as a very heavy, dragging fatigue that sits with you all day, every day, sometimes for weeks or for months on end. And like I said, it's not improved by simply going to bed a bit earlier in the evening. And the reason for this symptom is pretty straightforward. So with less hemoglobin or less iron in your blood, your muscles and your brain are getting less oxygen than they need to actually function properly. So everything feels harder than it should. Now, people very often just push through this for a long time, thinking they just need to work less or rest more, or maybe reduce their hours at work, or they blame it on something else, maybe, somebody in the family or a friend or some financial problems, when all along it is just something going wrong inside their body that can be fixed very simply. Basically, their cells are crying out for oxygen, but there isn't enough iron to carry that oxygen around the body. Now, closely linked to that is the second sign, which is becoming breathless when you do things that never really used to be difficult or never used to leave you breathless before, like climbing a single flight of stairs or walking up a very small hill or carrying the shopping from the car to the kitchen suddenly leaves you puffing for breath, or like you just need to sit down and catch your breath for a bit. And the mechanism is basically the same as that first one, only a bit more dramatic. So when the blood can't carry enough oxygen around your body, your lungs and your heart work overtime to compensate for that. So it makes you breathe faster and your heart pumps harder to try and deliver what it can. Now, people often notice this first when they're exercising or in the gym, when they feel like their fitness has fallen off a cliff for no obvious reason, and they assume it must just be their age or being out of shape. In reality, sometimes it is a very quiet drop in their iron stores. So if you're somebody who has always been quite fit or in shape, and you suddenly realize that you can't do what you used to do, if you're on the treadmill and you can't quite get up to speed, or you feel like you're losing fitness, then go and book a blood test with your GP. The third sign is becoming quite pale in your skin, particularly in places that you can easily check yourself. So the inner lining of your lower eyelid is one of the best places to check the conjunctiva, because pulling it down gently should reveal a healthy sort of reddish pink colour. I hope I've got that reddish pink colour on camera. If it's looking distinctly pale or even white, then that could be a very useful clue. The same goes for the inside of your lips as well, or the beds of your nails and the palms of your hands. And the reason for that paleness is, again, pretty simple. It's that the rich red colour or pink colour of your skin or your tissues comes from that hemoglobin. And when there's less of it circulating, that colour starts to fade. Now, obviously, it's harder to spot in people with darker skin tones, which is part of why doctors miss this quite commonly. And in my opinion, the medical textbooks that we learn from, the images that we see as part of our training, isn't representative of our, inclusive population, which is why people with darker skin, we've got to take the rest of these symptoms a lot more seriously, and we should be offering blood tests a lot more readily as well. The fourth sign sits within your hair and your nails. Now, iron is needed for the rapidly dividing cells that produce both of those, your hair and your nails. So when your iron stores are running low, the body essentially deprioritizes them. It sends what little iron is available to the more important organs first, because obviously we don't need hair and nails to actually survive. Now, hair that's actually shedding or falling out tends to be the most distressing version of this at the very extreme end, where people notice more hair in their hairbrush or in their shower drain, or sometimes clumps falling out as well. And with your nails, nails can become a bit brittle or a bit thin, and they can split as well, or even develop, ridges in them as well that feel a bit rough. Now, in severe deficiency, you can also get a problem called koilonychia, which is where the nails actually flatten or spoon inwards at the edges. Rather than being round like that, they can go inwards, although that is quite often a later sign. The fifth sign is one that most people don't actually realise has anything to do with iron, and it's restless leg syndrome. So that is that very uncomfortable, creepy, crawling, almost itchy feeling in your legs, usually when you're trying to fall asleep, that drives you, absolutely crazy, and it drives you to move them just to get any sort of relief, which is why we call it restless leg syndrome. And there is a very clear link between low iron stores in the brain and this particular symptom, because iron is needed to produce certain brain chemicals, including dopamine, that helps to regulate movement. So when stores run low, those signals get disrupted, and then the legs start doing this very strange, restless thing at night. Now, many people literally suffer with this for decades before ever going to the doctor about it. And even then, sometimes the doctor will never even think to do an iron study blood test. So if this is you, then please go to your doctor and ask them to do a blood test that looks at your iron stores. The sixth sign is cognitive this time, and it's this brain fog and difficulty concentrating that very often comes with low iron. So your brain is literally the greediest organ in your body for oxygen, and it uses around 20% of everything that you breathe, despite it only weighing around 2% of your total body weight. So when your oxygen delivery falls, which it does in iron deficiency, because like I said earlier, you need iron to transport oxygen around the body, your brain very often feels it first. And people describe their thinking as really slow, or their memory is a bit slippery, or their ability to focus on a task as much weaker than it is usually. Iron deficiency also disrupts those brain chemicals that I mentioned a moment ago, which can affect your mood and your motivation alongside these cognitive symptoms. And the whole thing can look very much like burnout or depression or anxiety, when in fact it's all to do with your iron. Okay, so the seventh sign on this list today is probably the strangest one, and it's this particular craving that we call pica or pica syndrome, which is this medical term for the urge to chew on things that aren't food, or to eat things that aren't food or nutritious for you. And this is one of these conditions that I remember vividly from medical school. So the most common version of this is ice, where adults crave ice and they just chew on ice all day. Literally sometimes a glass or a bowl full of ice at a time. Less commonly, people crave things like clay or chalk or paper or soil. Once I've seen people eating metal in the A&E cubicle. Literally, I'm not making this up. People very occasionally eat very wacky things. And obviously this is a medical condition like anything else, and these patients don't understand why this is happening. And iron deficiency isn't the only cause for this, but it is a symptom of iron deficiency that we see very occasionally. And it tends to disappear once the condition is fixed, once we diagnose the patient and we replenish their iron stores. So if you or somebody that you love has developed a very weird sort of craving for things that aren't food, or you see them munching on ice, then you've got to take this seriously. And then finally, the eighth sign on this list today is all about your mouth. So iron is essential for maintaining the delicate cells lining your tongue and the corners of your lips, so just here. So when your iron stores drop, the tongue can become quite sore or red, or very smooth as well, basically quite inflamed, very often losing that rough texture from your taste buds that a normal tongue would have. Now, some people notice a burning sensation, particularly with hot or spicy food, and alongside this, you can get very painful cracks at the corners of your mouth, which we call angular cheilitis, where the skin splits and is very slow to heal. Now, these are very subtle signs and they present very early, and they're very frequently overlooked unless somebody is specifically looking for them. Now, going back to angular colitis, so I actually had this in medical school in my 4th year, and what I'm basically addressing here is this overriding point that if you have some of the symptoms on this list, it doesn't necessarily mean that you have iron deficiency. There are lots of different causes for these symptoms, and it's just a reason to go and get checked out. Now, I had all of my blood tests done and they were fine. It turns out, very, very long story short, that it was simply stress and poor sleep that was causing this. And when I reined in my studying and my revision, and I slept properly for the next few weeks and months, it completely resolved. Who knows for certain whether that was the cause? The important point is you've got to get checked out, have a blood test done, be examined properly, and have your doctor take a thorough history about every part of your lifestyle. And looking back across all of those 8 signs, what's really striking is, again, just how non-specific they are. The tiredness, the breathlessness, the paleness in the skin, or the conjunctiva, or the brain fog, or the restless legs, the sore tongue, any one of them on its own could be a dozen different things, which is exactly why iron deficiency tends to slip through the cracks. You know, doctors are really busy these days, appointments are really short, and most of the symptoms get put down to stress or lifestyle or just being a bit run down. The other reason it gets missed is that early iron deficiency can still leave your very standard blood count looking acceptable, your hemoglobin level. So you can be iron deficient, but still have a normal hemoglobin, well, a low-ish normal hemoglobin. And that is because your body burns through its stored iron long before the hemoglobin itself drops dangerously low. Now, as I mentioned earlier, a ferritin blood test is the test that actually picks this up. And unless somebody specifically requests it, it often doesn't get done. It's not the standard first-line test that we reach for. Now, let's go back to what I promised at the start, which is about what we eat. So if you have iron deficiency or you're concerned that this could be you, then focusing on your diet, obviously you've got to go to the doctors as well and get it checked out for certain, but it's always a good sort of reason to start looking at what you eat. Now, there are 2 forms of iron in your food, and they behave quite differently inside the body. The first one is what we call heme iron, which comes from animal sources, and it's the form that your body absorbs most easily. The best sources of heme iron are obviously red meat, particularly lean beef and lamb and liver if you can stomach it, which is genuinely one of the most iron-dense foods on the planet because, as we know, if you've watched any of these videos, all of the blood in your body is basically filtered through the liver. But there's also sardines and other oily fish like mackerel as well, and shellfish like mussels and oysters, which are surprisingly rich iron sources as well. Now, obviously, I'm not saying that you should have every single meal full of red meat because there could be some risks with that, but it could be a reason to introduce a bit more meat into your diet if you don't eat any at all. The second form is non-heme iron, which comes obviously from plants, and it's absorbed a bit less efficiently, but it's still a really good contributor over time. Good plant sources include things like lentils, and chickpeas and red kidney beans, and dark leafy greens like spinach and kale, which are so good for you, and pumpkin seeds as well. And a really useful trick that's worth knowing is that vitamin C significantly boosts your absorption of those plant-based iron sources. So eating those